Welcome and thank you for joining us. You've reached the ICD classroom. I'm your host tonight and ICD President Cindy Sullivan. All right, tonight's presenters are Deacon Joe Ferrari and students Devik Patel, Safa Asad, and Helena Swanson. Deacon Joe is a professor of psychology and St. Vincent dePaul Distinguished Professor at dePaul University, Chicago, Illinois. He is also the author of over 400 scholarly publications and 700 conference presentations. Dr. Ferrari is a permanent deacon in the Roman Catholic Church, serving the Diocese of Joliet, Illinois, since August 2013. He is a global speaker and scholar on applied social, community, personality, psychology topics. Reverend Dr. Ferrari's research is known internationally for the study of the causes and consequences of chronic procrastination. He is the author of the highly successful popular book, Still Procrastinating? The No Regrets Guide to Getting It Done. John M. Wiley & Sons is the publisher on that, and it's available through Amazon. Devik Patel, Dev, is a graduate of dePaul University and a first-year master's student earning a degree in general psychology. She is interested in researching how our personalities and physical environments affect decision-making processes. Safa Asad graduated with a BA in psychology from the University of Illinois in Chicago. She has research experience in early childhood development and is passionate about childhood literacy. As a doctoral student in dePaul University's Community Psychology program, she hopes to conduct research examining the factors that lead to a variability in children's educational opportunities and outcomes that will inform intervention programs. And Helena Swanson. Helena Swanson is a second-year community psychology Ph.D. student at dePaul University. She is originally from Connecticut and graduated from Central Connecticut State University in 2019 with a major in psychology and a minor in gerontology. She has been researching clutter and procrastination with Deacon Joe Ferrari since starting her graduate program. Welcome, Dr. Deacon Joe Ferrari and students Devik Patel, Safa Asad, and Helena Swanson. The class is now yours.
That was great. Boy, who is this guy Ferrari? Thank you, Cindy, very much. I want to jump right into screen share. So yes, tonight I wanted to, first of all, for those of you out there, and I believe we're up to 39 people. So I know that a number of you last week when I spoke said you'd return this week. Last week I talked about self-care, taking time to take care of yourself during COVID, because I know ICD members are givers, and there's time you need to step back and give to yourself. There's nothing wrong with self-care. And then tonight, I wanted to talk a little bit more about some of the projects we hot off the press just came out, right, guys? In fact, one hasn't even come out yet, but it will be coming out very shortly. And then this project that we're working on, that I'm working with Catherine Roster. So we're looking at COVID and clutter, as I like to call it, some home and office clutter. So a little bit less than focusing on your home, but we've been doing and what we've been looking at during this global pandemic. And you've met everybody, so I'm just going to move to the next slide. Got to thank people. Cindy, I didn't know I'd have you tonight, so I didn't get to put your name in here, but you need to be in here. Thank you too. But first, of course, I always thank my friend Catherine Roster, whom I met through ICD a number of years ago, and boy, what a great friend she has been. She's really moved from colleague to friend, and I just enjoy working with her. We get along so well, and she keeps me in line, and I keep her in line, and I like Ross. And also, we have had some really great undergrads who are not joining us tonight, but have also been our team. During COVID, I've really shrunken my team down, but Ryan has been with me the longest, 3 or 4, his fourth year, and he'll be graduating this year, and Lily, who is just starting. So I thank them. We thank them. And of course, from ICD, I thank Amanda and Heather and Lorraine and Cindy for all of your help. Let's get back on task here. What's the structure? What's the goal for tonight? We're going to have the graduate students present some original work that we've been doing during 2020 on some of our clutter studies. We're just going to cover 2. And we're going to look at also the spread of COVID over 2020 and how that may have impacted or is impacting on decluttering. And then finally, I want to talk a little bit along with the team about this Decide to Declutter study that Roster and I are trying to work with. In case you're not familiar, I know you've heard about it. We keep badgering you, please sign up, but I want to talk a little bit about some of that. For each of the presentations by the students, we're going to do three things here, something to break down some of the abstractness of research, what I like to call what, so what, now what. So they're going to tell you what was the study, all right, who we studied, what we did, so what, basic, I'm from New York, as many of you know, so what? What are some of the simple results? And then now what? So how can this information that you've just shared, Ferrari and team, help me as an ICD member, as a coach? So you may or may not be heard of this concept, this what, so what, now what. But it's a strategy that's used in a number of settings. All right, the first presentation is going to be by Dev. And I'm just going to get started here for you, Dev, and then you can take over. Are you ready to chat a little, Dev?
Yeah, I'm ready to go.
Okay, I'm going to see if I can mute myself. There I go.
So past research suggests that clutter has an impact on our well-being. It impacts how satisfied we are with our physical environments, our reactions to stress. It can impact our tendency to be indecisive and exhaustion. So we wanted to take a closer look at a sample of employees that were working on site in their offices to see if there were differences in various work-related variables depending on one's rank within an organization. So on the left, we have different work-related variables that we measured. Some examples: emotional exhaustion, job satisfaction, engagement with work, indecision. And then on the right, we have the two groups that employees were categorized into. So in upper level employees, we had top management, so that's C-suite positions, board positions. We had middle management and lower management and supervisory positions. And then in the lower level, we had staff and administrative employees and individual contributors. So we wanted to see if there were any differences in the variables on the left, depending on what group the employee belonged to.
And I'm going to jump in too, because my students know I can never just sit back. So again, perfect, exactly right. We have all these factors that we asked people about. Now you might be saying, well, why didn't you be more specific, looking at upper level, upper and lower, what a CEO different than maybe a middle manager? That's true. Our sample size is not huge. And so we felt that the best way to really capture this was to really kind of talking about management versus employees, if you would, but the more politically correct way of calling it is upper level and perhaps lower level. This is an article that's currently in press, and I mentioned to you, so it's hot off the press, it's supposed to come out. I heard a little bit from the publisher today. I can share with my students when we meet on Wednesday at our team, but you're getting something hot off the press.
All right, so we recruited our participants on Prolific Academic. The sample in this analysis consisted of 202 US residents. There were 121 men and 78 women, and they all worked more than 20 hours a week to qualify for this. The split between upper level and lower level was pretty even. There were slightly more lower level employees. The majority of them, 87%, were less than 45 years old, so younger than 45 years old, and 78% were white. Again, this survey was offered on Prolific Academic. It took around 20 to 25 minutes to complete, and the participants were paid $260 for completing all of the measures.
Hold on. Let me jump in. What's this Prolific Academic? This is a website that Ross found. Roster knows very well. She's a great survey researcher. In fact, she's known nationally, as you know, for doing surveys. And she said, well, look, this is a crowdsourcing program. It's called Prolific Academic. You may have, listeners out there, I heard of a thing called MTurk. Don't use MTurk. Nobody does publications with MTurk anymore. I don't know all the reasons, but they're considered not very accurate. Prolific Academic, you pay a little bit more, but better source of data. And so again, people were paid $2.60 to complete this. You might say that's all. Yeah, well, because there are people, literally, as you may know, sit there online. This is what they do. This is almost like a job for many of them, to answer surveys. So what did we find?
Our results. We found that clutter, or upper level employees, are more likely to perceive and report clutter than lower level employees. There was no difference in the type of clutter that they reported. The top three categories were paper, office equipment, and trash, in that order. And we found that clutter in work environments is related negatively to satisfaction and pleasure from work, and positively related to risk for burnout and tension. And so when employees perceive
Well,
clutter.
before we jump to, are you jumping to the next? Don't jump to the next slide.
Okay.
Yeah, okay. No. Okay. So, a couple of really cool things with this. Okay. As far as I know, as far as Ross knows, this is the first study that looks at what is the clutter that people are saying. We could not find anybody who talks about what is the clutter. Now, you know, if you've been following Ross and my work, we've been looking at the person factor. What are people? How does it affect the person? And who's more likely to have the clutter? Blah, 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 blah. That's fine. But I was wondering, but what is the clutter? What do people, and I believe, maybe you remember, Dev, well over 700 items people listed, those 200 people listed as what was clutter. And so we asked them to tell what is the most, and your second most, and your third most, and fourth and fifth. And so what we're reporting here is the top three. So interesting, and maybe not surprising, although maybe surprising in this digital age, paper. Magazines, pieces of paper, copies, folders, files seems to be the number one. And again, you're sitting there and you guys are probably shaking your heads. Yeah, nope, see that all the time. This is in the workplace. These are people in the workplace. And Dev will tell you in a minute how all this means. And then office equipment, people have a lot of extra stuff around. And then I thought would be number one, coffee cups and, just trash around, whatever that might be. And that's actually was not the number one. It was number three. But again, you can tell your clients, I don't want to steal your thunder, but you can tell your clients that the more clutter they have at work, the less satisfaction they're going to have. But I'm going to let Dev take you to that. All right. So what? Tell us what you found.
So we hypothesized that in traditional work offices, on-site workers, clutter would impact employees differently based on their rank within an organization. And so that upper level and lower level employees would have different ways of perceiving clutter, and the impacts would be different. We found that clutter in work environments is negatively related to satisfaction, meaning that perceiving clutter may reduce one's job satisfaction. And we found that clutter was positively related to risk for burnout and tension, suggesting that clutter may contribute to stress and burnout. And this is true for all employees, regardless of their rank. What we did find, like Joe said, that was interesting is that upper level employees are more likely to notice the clutter. And so they are at a higher risk of burnout as a result of clutter than lower level employees.
Yeah, and I want to jump in here again because this is really powerful stuff that you just said. Okay, so what are we saying? That if you can tell your employee, your clients who may have employees, that look, the clutter they're having in the office, the employee with lots of clutter is not going to be very satisfied with their life, is not going to really enjoy their work, and it's really going to lead to higher risk. And particularly interesting, and it didn't matter if they're a manager, the CEO, or the receptionist. This affects everybody. That's interesting to me. That's interesting. But as Dev just said, those managers and those CEOs, they notice the clutter, and that impacts them negatively in terms of risks. So everybody's got the clutter. Doesn't matter what type, apparently, but noticing it makes a difference. All right. So what does this mean for you?
So the takeaway from this short but important study was that clutter plays an important role in job satisfaction and performance, and leaders should consider how they can create an environment that fosters positive work attitudes and behaviors. Offering decluttering strategies and promoting decluttering behavior may promote employees' engagement with work, their satisfaction with their work, and their overall well-being. Decluttering may also reduce the risk of burnout, which is of great concern for leaders amidst a pandemic and as we transition from working at home to working on site again.
So the next study, okay, I'm going to ask Safa to lead us into this one.
That was perfect timing by Paul to ask that question, because I actually looked at the 88 remote workers. So with COVID-19 and global pandemic coming on, there's been a transition from the on-site workers to remote to workers who work from home. And so this study explored how remote homework might be complicated by procrastination tendencies and office clutter. So previous research in our lab showed that office clutter results in emotional exhaustion among workers, especially if they're indecisive. And then office clutter among self-identified indecisive people negatively impacted employee performance when there's a perceived loss of control over one time. And as Dev mentioned, that emotional exhaustion and depleted energy could lead made decisional delays more likely. So this study examined how indecision and behavior procrastination related to home office clutter and job performance among remote home workers. It was providing a baseline understanding of remote workers at home, and this was done prior to the global pandemic.
Right. Good. I'm glad you said that, because I want people to realize we didn't collect this data during the pandemic. That's the study that Ross and I are doing now. This was collected just before it started. So nobody has any data until hopefully some of the information we have on remote workers from home and the pandemic. We just have it on remote workers from home. And it's a small sample, but that's okay. But absolutely right. So this is kind of continuing some of the work that we've been doing here as well. So, and this came out, or actually coming out in the January, February issue of this particular journal. I can't work with all this stuff is kind of our title for it. Okay, so let's go on to the next. Tell us more about these people.
Right. As Joe mentioned, this is kind of a smaller sample. So it's 88 U.S. home workers, the majority of which were men, and all of them were under the age of 45. And again, they were surveyed online before the start of the pandemic on home office clutter, indecision, and behavioral procrastination, and those work-related affective and behavioral factors. So with behavioral factors, we mean like their engagement with work, job-related tension, perceived work stress, and job satisfaction, as well as their clutter workload and perception of their personal workspace. We also examined the items participants more often identified as clutter in their homes, in their home office, and one's procrastination tendencies and office clutter impacting their work behaviors.
Okay, so I'm just going to jump in here. So we had noticed 202, here's 88, that's correct. We had 290 people that Ross and I collected. And when we looked in that and we were thinking about these remote workers from home, we began to think, do we have any data on that? And so we found within that bigger set. So these are the same measures that you just heard about. That's why we're not going into all that detail. But there were 88 people who simply said, I work from home. And that's what these are. So when we say work-related affective behavioral factors, all of these, well, these are what Dev talked about. One particularly interesting scale to me that I find, this perception of control of my time, which kind of led Ross and I into our next the study we're doing now. So now I'm home. I have more time. I think I should. I'm not commuting. I don't have to do all this. How does that impact? But again, these are, unlike all the other stuff we've often talked about, at home clutter, we're looking at office clutter, although this is, of course, home office clutter. Am I making sense there? I feel like I'm just rambling. Okay, so what did we find?
Right. So our results showed that work-related behaviors are adversely or negatively impacted by home office clutter amongst remote workers. Indecision and behavioral procrastination related to poor job performance, emotional exhaustion, and low work time control, which Joe was just mentioning. So indecision predicted high home office clutter, emotional exhaustion, job satisfaction, and attitudes towards personal space. And the top three self-reported office clutter was, again, paper, trash, and office supply.
So, okay, let me stop in there again. So same thing, remember, we asked people to list the top five, and we want to, as we say in the trade, mine it more, go back in like a miner and redig through the data and see if we find more. But I just wanted to look at what were the top three that people might have reported, and always came up as paper. So even the remote worker, remember the other study, the office worker, if you would, the traditional office worker, now the person at home still says, I have a lot of paper. It's a good thing you don't see my office here, in my home office, because I got some piles that you can't see. But now trash has moved up. I don't have used coffee cups, but we have all of that. And then supplies, and I have pens, pencils, paper clips. People seem to have a lot of that. So again, we're looking at, these are the first two studies that looked at what is the clutter that people report. Okay.
So what were we looking at? So and why is it important? I think that's a really important question. So COVID-19 has forced so many people in work from home situations. So for this study, we hypothesized that an overaccumulation of items such as clutter may impede an individual's well-being and connecting with their home environment because of stress and negative stigma associated with clutter. And so our results found that before the COVID-19 pandemic, home office workers reported procrastination significantly related to their job-related tension, emotional exhaustion, and lower job satisfactions. Employee-related behaviors were adversely impacted by home office clutter. And again, the most often items listed as office clutter were paper and trash.
And this may not surprise you guys, you ICD people, paper and trash stuff. But, this is, again, no one's ever reported that. Now you can tell your clients, paper is what people are telling us. Go ahead. So
now what probably is what all of you are asking. So we have all of this information. We know, yes, people even at home that are accumulating clutter are having these negative emotions. So what can we learn from that? So assessing productivity and office space characteristics of these remote workers, especially during this time, might enable employers to make informed decisions about which employees succeed in their working environments. So as we said, our lab found that organizations suffer when their employees are unhealthy or unmotivated or performing at a lower level, and the impact of clutter on well-being can affect profit or employee motivation and conflicts and attitudes about work and employee behavior. So to mitigate these consequences of home office clutter on well-being, employers could work with their employees to increase their job satisfaction by encouraging employees to personalize their workspace. They could also, to decrease emotional exhaustion, employers might provide workshops and organizational structures to help employees that engage in behavioral procrastination, and also helping employees determine and prioritize which items are actually necessary for their space, and then spending dedicated time each week to remove these items and to declutter their space.
Now, you guys know best, you ICD coaches, what advice, this is us, the outside, based on what we read. And so you might be looking at it, yeah, I've tried this and it doesn't work. Or you might say, but you didn't mention this or that. Well, yeah, because this is your profession. All right. So we're just trying to say that there's some advice that you can give. This is useful. We think this information is useful for your clients. True, small sample size. However, no one's ever looked at this before. And what it really suggests, true, it was done before the pandemic, but it leads us to kind of say, I doubt if people suddenly emptied their offices because a pandemic was here. Great job. Another great job. I love it. These guys are unbelievable. They really are. So those have been our two data-driven studies that have just come out or are coming out. You're getting these hot off the press this year. Okay, so then Helena is now going to talk to us about COVID more.
Yeah. So hi everyone, I'm Helena. So I'm going to talk about something that we have all been experiencing for the last year. So I'm just going to provide some numbers and a little bit more contextual factors to the COVID-19 pandemic impacting specifically the U.S. So this map shows the COVID-19 case rate in the U.S. reported by the CDC. So this is data all since January 21st, 2020. So this is the data since from January 21st, 2020 to about a week or so ago when I took the screenshot. So we can see that the areas that are the most darkest blue are the areas that have been most affected by the COVID-19 and the case rate specifically. So a lot of those areas seem to be in the Midwest. And then there's some other scattered areas. There's Tennessee, Rhode Island looks to be pretty dark blue. And then the bottom section are the U.S. territories, which seem to be relatively low when it comes to the case rate. But the purpose of looking at this map is to see that different areas have been affected very differently by the COVID-19 pandemic. And as all of you know, you are from many different areas, so I'm sure that you can find your home state or at least somewhere you've visited before if you're not in the United States, and see how where it falls on this scale. And so the COVID-19 has impacted us in a variety of ways. Psychological impact is a big one. Many people are experiencing anxiety, depression, or both. And this is data that was captured by a foundation where they measured anxiety, depression, or both symptoms over a period of time. So this is from May to July 2020. And we can see that as the pandemic progressed, psychological symptomology increased steadily. And this is from July 2020. We are not sure what the data looks like now. This foundation only collected until then, but I would imagine that unfortunately it's probably only steadily increased since that time.
So in other words, the last 6 months, we could, since this is showing this increase, all right, we can predict it's probably continuing to increase. People are reporting more symptoms, more anxiety, more depression. And by the way, can I just jump in, Helena, quick? Okay.
Yeah,
I was at
absolutely.
another webinar, another thing where the presenter said, and it's highest among young people. We often think that this would be older people, my age, but actually it's younger people. And they're feeling much more lonely than older people. I thought that was very fascinating. I don't really remember all the data, but I just remember that. That was contrary to what people are expecting.
So
Okay.
there's some various other ways that I'm sure you've all heard about that people are being impacted by COVID. So in the US specifically, 50% of households in major cities reported having serious financial difficulties. 43% of rural households reported losing a job or being furloughed or reduced wages. So think about those Midwest areas also that have been so highly impacted by case rates are also being highly impacted in the rural areas of them in job and wage loss. And then 20% of households report household members being unable to seek medical care for serious problems. And this is likely due to issues with health insurance or reduced wages, financial problems, and things like that.
Those of you, and this is from Robert Woods Johnson, which is, of course, as you all know, a major source. If you were with me last week, you remember I talked about we are not in the same boat. We are in the same storm. In other words, some people are affected worse than other people. This is the same storm, but some people are weathering the storm a little bit better than others. And we talked about that. And as Diane and I read we don't know the author, but this has been something that's been circulating on the web. So this supports that as well. Okay.
Yep.
So
and something I just want
right.
to add is that the issues between like financial problems, wage loss, medical care, and psychological impact are not separate. They likely are playing into each other in a very strong manner.
That's a good point. That's true. Okay, I'm going to let you talk.
So many scholars and organizations seek to understand the ways that individuals and communities at large are being impacted by COVID. And some of these ways include infection rates, psychological symptoms, financial, health, and occupational, like we've discussed. So from these results, we can conclude that many individuals are experiencing consequences of the pandemic, and some are primary as direct result of the pandemic, like infection, and some are secondary impacts, like financial and occupational. And now what? So we want to understand the unique way the pandemic has impacted ICD members specifically, to recognize the difference in members' experiences and tailor services to the need of each specific member.
So as an ICD coach, go ahead.
So as a coach yourself, better understanding your client's clutter and decluttering tendencies, given their current emotional state during the pandemic, is really important for understanding how to best serve them.
So this may not be surprising to you, or it might be, you IDC coaches listening to this, but the data is supporting what you are finding on the streets, on the ground, as they say. Great, thank you, Helena. Okay, so what does this take us to the new things? Our new research, you've heard us talk about this. We've been browbeating you, begging you to please participate. And if you want to know a little bit more about what that study is, there's 39 people here. So I'm hoping that there's at least 35 of you ICD coaches out there. Get us your clients, get us your there. So what we are trying to do, Roster and I, is answer these questions. What are the decision-making processes that are involved when someone is trying to declutter? What are they thinking about, right? What is it that's going on? And then what are they reporting? What are they telling us are the emotional, the physical, and the cognitive barriers to the decluttering? Again, you might say, well, I know this, but we don't have the data. And there's nothing like, as you know, data-driven. Me and Fauci are together on this one. There's nothing like data-driven decisions as we're supposed to be making. So these are some of the questions that we've been asking. Now, we've had only about 160 people complete the study. And Dev has been monitoring. Now, that was as of the 22nd. So as of today, I think you told me what, Dev? How many?
We're at 163 today that have completed all of the measures.
Okay, so we've gone up 3 people in the last 4 days, and that's not many people. This is yet another link, a shorter link, if you want to write it down. So out of that 160 people, most of them are women, as you'd expect. The average age is about 50. Most of them tend to be Caucasian, white people. It may not turn out to be at the end, but I just wanted to let you know what we're finding so far. This has been up meaning available for completing, I think, Cindy, do you know how long, or Lorraine, was it like, has it been like a 5 weeks, 6 weeks, 4 weeks? It's been a while, no? Yes?
I want to say it's been up for, I think you're right, about 5 weeks.
Okay, so it's been there a while, and I would have expected, Ross and I would have more than 163 people. So I would love by the end of this week, because of this conversation, to see 263. That would be pretty neat. All right, so what are we looking at? It's a lengthy measure. I know that if your clients have been telling that, because we've got 14 scales in there. And I am not listing all 14, but I just want to put down some of the ones we're going to do there. Ross and I always use the clutter scale that you guys were so kind to help us create originally. But there's a measure that looks at fear of COVID, my indecision, a hesitation, why people might be hesitant to clean. I'm just giving you 8 of them here. You know me, and I love this concept of home. What do people perceive as their home? This is a really neat concept for those who don't know. Psychological reactance. Let me take a drink of water. The grad students may know this, but as a social psychologist, one thing we know that people sometimes have reactance. Let me digress here for a minute. Reactance is this notion, which we call in the vernacular every day, the oh yeah effect, where people are willing to do something, but once you tell them you have to do it, you get reactance. Or, oh yeah, as we say in New York, the oh yeah effect. I was going to do that, but now I'm not. Now, this is an old concept, originally started with smoking. If you said to people, no smoking in this site over here, people used to say, oh yeah, just for that, I'm going to smoke. I was going to put my cigarette out, but now you're making me have to. I'm going to have to. Now you can think about COVID and the masks that are going on. So that's called reactance, psychological reactance, or sometimes called the oh yeah effect that people have. That's why, and again, I'm going to digress even more, I tell my students, a thank you poster is much more effective in research than please don't posters. What do I mean? What do I mean? If you say, please don't smoke, please don't litter, please don't do this, you're going to get reactance. But if you say, thank you for not littering, thank you for not smoking, you're more likely to get compliance. You're more likely to get people to follow. I don't know if you guys know this out there, but keep that in mind as you deal with your clients. The thank yous. Why? I like to call it, maybe because I'm a clergy, the Catholic guilt kind of thing. Oh, okay, I better do that. All right, but people feel some sort of guilt. So we wanted to look at how much is reactance playing a role for why people are not decluttering. I talked about the indecision, hesitation, the disposal behavior tendencies. Ross came across this measure of what's people's tendency to dispose of stuff. And then because we're looking at these cognitively, all right, and this is Dev's interest for her master's thesis, we're interested in looking more about some of the cognitive factors that are going on. What are people thinking about? How comfortable are they? How much confidence they have in their decisions? And there are more than these 8, but I just wanted to give you, whet your appetite for what some of the scales are. So if you think of particular clients you have who you might be suffering, invite them. Okay, so what's been the method? We've posted it now for a good 5 weeks. It's been available for over 6 weeks. Okay, I guess there was my answer. It takes a while to do, 30 to 40 minutes. There's been no incentive to do this, but as of now, we're still hoping to collect more data. In fact, we've kind of agreed, I think with Amanda, to leave this up on their website for maybe another month to hopefully get more people. Why does it take so long? All right, again, this is between us. Don't tell your clients. It starts off with a really neat measure called don't share this with your clients, called personal projects. Now, this was created by a guy named Brian Little out of Canada long time ago. Very good friend of mine. His doctoral dissertation on procrastination was on personal projects. It kind of combines qualitative method and quantitative method because it asks people to list their personal projects that they're working on and then gives them a grid to which to rate that project on that. So this particular study, Ross fell in love with this, and I knew of it, but she said, we really got to use this, and it's taking people a long time. So the first block of questions is asking people to do that, and people are burning out and saying, I don't want to finish. Then the next block are all these questionnaires. So anyway, that's the sort of, again, there's the link. We're not going to really talk about any results because I don't want to bias any outcome, and I want to hear at the end here your thoughts. But just to talk about it, we're hoping to learn what motivates people to declutter among their home during this pandemic. We're trying to discover what might be the personal, the psychological, the social factors that might be hindering their decluttering or might be actually helping them to declutter. And then maybe to report what they report as their psychological, and then the environmental outcomes that they're experiencing. I have to be frank, I always am with you guys, that we're hoping to present this, we'd like, at your conference in Phoenix in October, the results of this as we slice and dice it lots of different ways or mine it, and we mine all that. But I think that's the end of, that's the end of my comments on that. Thank you for all you do, and any questions you might have.
Thank you so much, everybody.
Thank you. Live long and prosper.
Okay.
Okay.